Functional medicine is a hot topic these days. Instagram, Facebook, and TikTok feeds are filled with recommendations from experts who proclaim they know the answers to all the questions you have been asking your doctor, and yet seemingly never get answered from your doctor. So, what is functional medicine? Is it a new subspecialty in medicine, or is it just window dressing for the same type of con artists that people have been dealing with for decades? And how does it relate to our current Surgeon General, Dr. Casey Means? In this episode, I'll be talking with Dr. David Gorski, breast oncologist and managing editor of the Science-Based Medicine blog, to discuss these questions and many more. I'm Dr. Mark Papadakis, nobody particularly special, just another freaking ER doctor, and this is the JAFERD cast. If you are a self-described naturopathic, holistic, wellness healer type of person, then this episode is probably going to piss you off. David, hello. Welcome to the show.
Hello.
Thanks for joining me.
How are you? Thanks for inviting me.
So, Dr. David Gorski, you are a breast oncologic surgery. You have a PhD in cellular physiology from
Yes.
Case Western Reserve, as well as obviously your MD from University of Michigan, graduated general surgery residency, and a fellowship in surgical oncology, a surgical oncology research fellowship from University of Chicago, Illinois. And you're practicing in Detroit, is that correct?
Yeah, Wayne State University.
Awesome. So basically infinitely more qualified than I am right now. I love it.
I don't know about that, but yes.
So we talked about a little bit back and forth earlier. I saw you wrote an article. You've written many articles, but one of the articles you talked about recently, October, was about our incoming Surgeon General, Casey Means. And that's kind of started the whole discussion with regards to functional medicine.
Yes.
So I guess my first question becomes, why functional medicine? Like, this is a big topic you've read about in the past. How did you kind of get involved into writing about this?
Well, I'm not the first, for instance, I'm the managing editor of the Science-Based Medicine blog, and I am not the first person on that blog to have written about functional medicine. I believe Wally Sampson, who is unfortunately no longer with us, was, and this was like way back around 2008. In any event, functional medicine is interesting because it can very easily fool, a patient and a fair number of doctors into thinking that it's actually, scientific and evidence-based.
Well, functional medicine sounds pretty scientific. Like, at a glance, I'm being serious. That
Well, sure.
like, that sounds impressive.
The name was chosen, n- intentionally, I'm sure. And it's something that's only been around since the 80s or 90s. It's relatively recent as far, it's not like homeopathy or something like that that's been around, 200 and some odd years. But
Right. Well, as I say, that was my next question, which is, we hear, naturopaths, homeopathy, and now functional medicine. But to me, personally, functional medicine is a relatively new thing that I'm starting to hear about within the past 5 years. But it's been around for so long. Why haven't I
It's
heard
been
more of
around
it?
at least since the 90s. It was there. It was pioneered, if you want to use that word, by a guy named Dr. Jeffrey Bland. But the real face of functional medicine now, or at least the most famous one, is Dr. Mark Hyman.
So that's going to need to ring a bell for me because I'm not familiar with him.
He was recruited about like in 2014, I believe, to form a functional medicine center at the Cleveland Clinic. I don't
Okay.
think he's associated with it anymore, but I haven't really looked into it in a few years. But he was recruited, to form a functional medicine center, and he's really, one of the big names in functional medicine.
Interesting how the Cleveland Clinic had an interest in, did they pursue him or did he apply to the
I
Cleveland
honestly
Clinic?
don't know. I suspect they pursued him because Cleveland Clinic is one of those themes of science-based medicine, especially early on, has been trying to shine a light on the infiltration of what we would consider pseudoscience and quackery into academic medicine. There's even a term for it. Even though I'm sometimes credited with it, I did not coin the term quack-ademic medicine.
I like it.
It's a term I use frequently, and it's basically where respectable academic medical centers start embracing all sorts of nonsense under the banner of quote unquote integrative medicine. It used to be called complementary and alternative medicine, as you may recall, but then, at least a decade ago, they started really shifting towards wanting to call it integrative medicine or integrative health, or as I like to say, integrating nonsense and quackery into medicine.
Well, there's always a term that I like to say that if it was, alternative medicine was actual medicine and it worked, it would just be called medicine,
Right,
you know?
and I forget who originally said that. I remembered Richard Dawkins said it, but I think it's also been said by a number of other people, and I really don't know who was the first.
Yeah, it's been, along social media a lot out there. And I feel like functional medicine has really gained ground in the age of social media. I mean, like you have between wellness influencers and all these other people out there, it's so easy to gain a foothold and basically to spread misinformation, half truths, things like that at a pace not seen, in the early days
Oh,
of
I
the
mean,
practice.
definitely, and especially since the pandemic,
Yeah,
which basically enabled the rise of people like, Casey Means,
right. Right.
RFK Jr. I've been writing about RFK Jr. for more than 20 years now, hard as it is to believe, because he first I don't know how long he had been anti-vax before that, but he first became known as being anti-vaccine in 2005 when he published that infamous article in Salon.com and Rolling Stone called Deadly Immunity.
Hmm.
I don't know if you ever read that.
I know of it. I couldn't bring myself to actually read it though.
It's basically a conspiracy theory. Basically, the idea is in 2000. So the whole idea is that there was mercury in vaccines in the form of thimerosal, which was a preservative used in vaccines until about 2001, 2002. And the idea was that was the cause for, the quote unquote autism epidemic.
Hmm.
The idea behind deadly immunity was that in 2000, the CDC had a meeting about a study by Ver Stratton and his colleagues, which was a large epidemiologic study that looked at whether thimerosal containing vaccines were associated with an increased risk of autism, and it found that they were not. However, the raw data seemed to show that they were, and then if you start adjusting for confounders, the effect went away. Well, a very typical anti-vaccine move is they misrepresent adjusting for confounders as an attempt to make associations go
Yes.
away, which is why you start and they still do it today. RFK, are talking about, the
I
same
was
sort of thing.
correct. And I was going to say, I made a post recently on Threads, and it basically says, hey, we're seeing flu cases now, get your flu shot. And oh boy, howdy, did my replies go with the anti vax people. But one thing was interesting because this one individual sent me a study and it looked at viral interference, and which, for those who don't know, viral
Oh God,
interference
was that the one with COVID, or was that the one with?
with the flu shot.
Well, it was like flu and COVID, I think. It
Correct.
was
Yeah.
like,
It's
because
something, it was
that
a
was an early
combination.
conspiracy theory, very early in the pandemic that I wrote about, like in 2020. I think it was even before the World Health Organization declared it a
Hmm.
pandemic.
Well, the study that came out actually came out within the last year, so there's an
Oh, okay,
updated one.
a new one.
There's a
Okay.
new one, but the study itself said there's no such. It's basically there's like, well, the results don't show this. Actually, because they looked at the Defense Department study looked at military recruits, the presence of either viral interference
Hmm.
or vaccine efficacy, and it found out that vaccine efficacy was actually really good for the flu, and there was no findings of viral interference. And viral interference in this context is basically saying, does the vaccine interfere with the body's own ability to fight off a virus or other viruses? And they're looking at
Yeah,
that
it's usually a
because,
different virus.
correct, yes, yeah. And in this situation, they found out that no, it doesn't. It's all bunk. But the individual, because I read the study and I said, you realize this paper actually supports my argument, right? That the flu vaccine is effective. And he came back and said, well, but if you look at the data, yes, that's what they conclude. But if you look at the subgroup analysis, you'll see that viral interference occurs. And I'm like, the subgroup analysis? What are we doing here? Come on, dude. It's just like these little things
Right.
that they do to sow doubt. And if somebody outside is reading this comment,
It could be like a big, beefy epidemiologic study, well controlled, well designed, well executed. They will find one little anomalous line
correct.
in one chart, like in one table.
Yep. And here we go. So I let it go. I wasn't gonna, stoop down to their level. But these are, tactics that the anti-vax, the functional medicine, the wellness influencers, they all present on social media. And boy,
Hmm.
does it sound convincing. I spoke to The last episode, Heather Simpson, she was a former anti-vax influencer turned now
Mhm.
pro-vax, but she became anti-vax not because she had a vendetta, but because she had questions that weren't adequately answered that became conveniently answered by the likes of the anti-vax community and RFK. And here's
Mhm.
somebody who to her mind, is like, oh, this guy's a lawyer, he's an environmentalist, this is a not a crazy guy. Well,
Right, right.
turns out he is
Oh,
crazy,
no, no, no,
but
no. He is so far down the rabbit hole of conspiracy theories that I've been writing about him for 20 years, and it's like when I started hearing some in our like when Trump won, or when he turned, or when he gave up his candidacy, his
mhm,
independent candidacy to bend the knee and kiss the ring, in promise for a high ranking position, in health in the federal government.
you
I
got it.
was like, oh my God, and
Mhm.
then I start hearing some of our colleagues like saying, oh, well, Maha, he's talking about diet and exercise. He's not really anti vaccine, and I'm like,
Uh-huh.
guys, people, I've been following him for like, almost 2 decades.
Yep.
It's,
And of course when Samoa happens with measles outbreak in Samoa and he went there, I mean, he is denied links to that, but the evidence is very clear with this whole
no, no,
situation.
no. In fairness, he didn't start the anti vax panic. He just glommed onto it after
Correct.
it got going.
Correct. And he makes money from it. Like,
Of
let's
course
be
he
honest.
does.
He's, his foundation, he gets, referral money still to this day, although he conveniently decided to put the foundation in his son's name. So he himself is not getting money, but his family name is absolutely getting money from
Well,
this.
yeah. I mean,
But that's,
especially now. I mean, whatever's happened to like the government, there are still rules about conflicts of interest that they can't just blatant. Well, they can, I guess they can, but
they can.
it's harder. It's not a good look to break them, even among their followers.
Right. Right. Now we talked about we're going to talk about Casey Means in a second, but I want to kind
Hmm.
of just go over functional medicine. I guess not really the origins per se, but what does functional medicine mean in the age of 2025 post COVID? Like what is its goal here? Is it just another name for, naturopathy and homeopathy
Not,
and all that?
not, there is a lot of nonsense in functional medicine, but functional medicine starts out with some certain key ideas. For instance, it's kind of like Harriet Hall, again, who's no longer with us, used to say about naturopathy that the things that are good about naturopathy are not unique to naturopathy, and the things that are bad about the things that are unique to naturopathy are not good.
Mm-hmm.
Basically same thing with functional medicine. So for instance, one of their big things is patient-centered medicine, whatever that means. Okay,
Right.
who's going to argue with that, right? Who's going to argue that the patient should be at the center of
It sounds
medicine
pretty
and
good to
that we
me.
should try to individualize patients? Now here's where it starts to go off the rails. One of the things that they talk about is biochemical individuality,
Mm-hmm.
as like the basis of functional medicine. So like the implication being that, you have to come up with something individual for every single patient. Now, the way I always respond to that is, yes, there's biochemical, biological variation between people, but we are more alike than we are different. Otherwise, evidence-based medicine wouldn't work. They
Correct.
make it sound like you
Correct.
have to like each person is so individual that, you have to come up with this bespoke treatment for them,
Mm-hmm.
and I look at it more as an excuse to, do whatever the hell they want.
Right.
It's like,
Right. Yeah. I mean, but and if you think about it, it speaks to the American idea of American exceptionalism, individuality. That well, yes, I'm special, I'm unique. So why shouldn't I have my own personal treatment plan?
and then where it really goes off the rails is what I like to say is functional medicine kind of combines the worst of evidence based medicine with the worst of alternative medicine. They will order like reams and reams of tests. Like Mark Hyman offers this panel of tests. It's like 140 tests,
Oh my god!
and
All a la carte, by the
looking for
way.
abnormalities, which they will correct with supplements and whatever. You know as well as I do, if you order enough tests, just by the way things are defined, there's going to be some of them that are abnormal. Like generally the normal range for most lab tests is like two standard deviations, I think, or
Hmm.
something. In any event, it's going to be roughly 5% abnormal tests, even if, in any, if you order over 100 tests, there's going to be probably just by random chance alone, five or more that are wrong, that are abnormal. And the just clinical experience and logic will tell us which ones we think are important, which ones are not, which ones we just check again or whatever. But they will try to correct every single one.
And I get a lot of people who come into the ER specifically talking about ESR and CRP.
I'm sorry, talking about what?
CRP, ESR and CRP.
Oh, okay, yes.
Those are the
Non-specific kind of non-specific test.
correct. Yes. And they said, well, can you check my CRP level? Like, why? What about your CRP are you concerned about? I said, well, if it's elevated, I could have this. And it's like, no. Like it's a marker for inflammation. Yes, I'm worried I have inflammation. All of us have inflammation to some degree, and because it's negative doesn't mean necessarily you don't have something going on either,
Right. Or like the ESR is even
yes,
less specific.
it's even more so, So now you have a situation where, okay, you are coming into the ER concerned about a test that maybe somebody ordered in good faith because some practitioner said, you know what, let's just check a couple of things and that's elevated and you see this. And there's no medical guidance now that you have because you just saw this on your, my chart or something like that as elevated. And you're like, oh my God. And you go down the rabbit hole and now it's all of a sudden, I'm worried I have like some weird mitochondrial dysfunction. That's a big one right now, I notice. And now I'm in the ER here to
Well,
say,
mitochondrial
sorry.
dysfunction has been like a long one. The other thing about functional medicine that's kind of funny is so it's very concerned about balances. So like
Yes.
hormone and transmitter imbalances, redox imbalances. That's a big one. Mitochondria, detoxification imbalances, immune
Sounds
imbalances.
like I'm balancing humors, back in the medieval era.
Precisely. That's what I've said. It sounds like humoral theory. It sounds like, or what a lot of people don't know is that traditional Chinese medicine is also very big on imbalances, hot versus cold and,
Mm.
like that sort of thing.
Mhm.
So, or wet versus dry, so it's like very much like, tacking ancient concepts of imbalances in the humors or in hot, cold, or dry, wet, etc., onto like hundreds of modern lab tests.
Mhm. Yep. And basically trying to say, well, here's a laboratory value that, you know, talks and speaks to this kind of theory. It's like, well, not really. But, I bring this up because I've had colleagues who, like you, look at functional medicine and think, oh, well, this speaks to me to some capacity. And I think we in the medical profession sometimes get a little bit like surprised that, well, what do you mean you're looking into this or looking into that? And especially the educated ones,
Hmm.
the other doctors and physicians we work with. It's like, well, but why? Why is this speaking to you? And you just said it earlier, which is, well, it's individual, it's biochemical. And I think more importantly, it answers questions that they're not getting right now from their doctor. And that's a slippery slope.
No, I mean, this kind of gets into why would some of our colleagues be attracted to this stuff. And one thing and I wrote I wrote a post a long time ago about a talk that Dr. Oz gave. Yeah, I know. Who can believe now that he's like in charge of CMS, like all Medicaid, Medicare, and Affordable Care Act programs.
Yep.
It's
Run
like
through here. Oh, yeah. Hmm.
go right through him in any event, where he's talking about like what being a healer meant, like in the old days or hundreds of years ago. And it was like what, like going back to like old shaman healers. And it's like there's something very attractive about that because the idea is you have like this more intense, relationship with your patient. You feel like you truly are like the healer. And, modern medicine kind of does not, work very well with that sort of idea. I mean, what are some primary care docs? What do they have for their visits? 10 or 15 minutes on some,
Right.
in some of them. They got to
That's
like
it.
just crank the patient's view
Hmm.
through. There's not a lot of time to talk about lifestyle and that sort of thing. I
And it's
mean,
frustrating for them because they know this is what's influencing and factoring into their patient's health, but they're not, and a lot of these doctors too are part of a larger
right.
organization or hospital system that basically is like, no, 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 you gotta turn these people out. Come on, 10, 15 minutes only. And for Medicare, Medicaid patients who are older or medically
Hmm.
complex, good luck. I mean, so Yeah, what are you going to do?
No, I mean, I'm somewhat fortunate, at least in that, like breast cancer surgery, I do actually have a bit more time. But even so, it's not unlimited.
Right. Well, Hank Green, he basically talked about his cancer diagnosis years ago during COVID, actually. And he talked about how he did go to not a wellness influencer, but a alternative, I guess, functional medicine at the time, person. He went to talk to his oncologist. He went to all these things, but he also went to talk to this person. And he said, in his words, I understand why people go to these people. I mean, he had an hour visit. You, as an oncologist, you used to spend an hour, talking with your patient in the office. Like, no, you can't, like, but he said that because the person I was with, I spent the hour with, their time was not in demand. He had the hour to spend to me to do all these things versus my oncologist, their time is in demand. They are in demand. So they have less and less time to fit everybody's demands in there. And of course, I was the end of the visit where this, wellness person, alternative therapy person, where he got sold the books, he got sold the therapies, all these little things. But, he came out feeling validated. He felt like he got heard. And then, we got all the brochures for the, a la carte stuff he threw in the trash. But it's that kind of idea too here, the fact that we as physicians don't get that kind of time.
I would imagine even less so in the emergency room.
Yeah. Yeah. 5 minutes. Like, hey, what you here for? Okay. I'll come back. Meanwhile, this person's in cardiac arrest. I'll see you later. Like, forget it. And it's even worse when people are coming to the ER and we are their primary care physician. These are people
Right.
with underinsured, uninsured, charity care. They don't go to the doctor regularly. So we are their doctor. And it's like, I'm not trained in managing diabetes or hypertension long term here, but
Right. If your sugar is 500, I can get it down.
correct. Yeah. It's not going to stay down, but I'll get it down for now. And that in a way brings me to Casey Means.
Right.
And, most people haven't heard about her until recently, but she's Donald Trump's nominee for Surgeon General.
Right.
And she is a physician in
She's almost an
she,
otolaryngologist.
correct.
She quit her residency in the final year, which is
Yes.
like unbelievable.
Yeah. And look,
Oh, no, no, look,
residency's
I'm
hard.
not criticizing her for that so much.
I
I
think
mean, if
there's some mixed reports
mhm.
that it wasn't because it was hard, because she basically was like disagreeing with the foundation of, she said that she disagreed with the foundation of what her training was, which was, well, we're not getting nutritional guidance and things like that in my residency.
Yeah, to which I say, why are you in ENT then? Because it's a subspecialty. You should be in primary care or internal
Correct.
medicine.
Yes. Internal medicine, primary care. Other reports are kind of saying,
Family medicine,
and so her reasons for leaving versus reality, I think, maybe a little bit different. But either way, she leaves residency, and fine. There's other things you can do with your medical degree other than clinical practice. But then she chose this path, which is like, what are we doing right now?
straight to functional medicine. Yes, I know.
So let me talk about that a little bit. What has she been doing? How did she, how did she get into this? What's been the process here?
Well, I mean, whatever her reason for leaving her residency, and it sounds like they gave her like a lot of opportunity to like think it over. Like she went on a leave of absence for a while and that sort of thing, which the other residents weren't too thrilled about because it's more work for them.
Hmm.
I guess she was. I think she was attracted to functional medicine because of, those whole reasons about, you know, being the total doctor and all of that. But she also, kind of talks about some sort of spiritual awakening, that she's like, which often goes along with these things. It's like a conversion story, like and alternative medicine loves a conversion story every bit as much as like religious people love a conversion story as long as the conversion is to their faith.
Right. Right. Exactly. You talk about somebody who leaves Catholicism and goes to become, like, Hindu or something like that. It's a different story than somebody who converts from uh, whatever religion to Catholicism. It's,
Well, the
yeah,
Hindu would view it, in the opposite way, would be happy about that.
right. Exactly. Yeah. But, did she write about this? I'm trying to see here. I'm looking stuff up myself. Did she
Well, yeah,
write
I
about her
mean,
departure, or is it all interviews?
she wrote about it in her book, and there was another thing that happened too. Her mother got a pancreatic cancer.
That's right.
And I mean, and
Yeah, so her mother
she
gets
seemed
pancreatic
to blame
cancer.
herself for like not seeing the signs earlier, because I guess she was, as is unfortunately the case a lot of the times with pancreatic cancer, by the time you get symptoms, your life is almost over.
Mhm.
Usually, it can be like weeks or a few months tops. I mean,
Whereas
if it's inoperable.
yeah, in those rare cases where it's caught early, then you have surgery, you have chemotherapy, you have other options available to you,
But they're
mostly
usually
surgery.
only caught early if it's an incidental like you find it
Right.
when imaging study for something else, because it's so infrequently caught early.
But then you have Steve Jobs as an example of this. And correct me if I'm wrong, but Steve Jobs' cancer was treatable when they caught it.
His is kind of interesting. I wrote about it when Isaacson's biography came out because I was like really curious about what happened. And I'm not entirely convinced that it was necessarily treatable when it was first diagnosed, but there's two, it's a gray area. There may very well have been liver metastases before that, but it's unclear. So I don't always like the story that, oh, he would be alive now if he had,
Yeah, no.
I mean, maybe he would have been. Maybe it would have mattered. It certainly wasn't good that he like wasted all those months on but that's not I'm not saying at all that he did himself any favor.
Right.
But
Yeah, and I think
he may have had the same outcome even if he went straight to conventional medicine because it's not clear to me that the cat wasn't already out of the bag.
yeah, and I think it's important to note that pancreatic cancer is a very, disease
Well, he had a
that's
neuroendocrine tumor, so it was like the much less, aggressive form, but it tends to be more indolent.
and I think that's where the gray area comes from because if it isn't a neuroendocrine form, it's like, well, sorry, there's surgery, we'll try it out, but here we are.
But I mean, adenocarcinoma, the most common form is like, if it's inoperable, you're basically, not going to survive.
Right. And it's funny because we see a lot of the AI tech bros, the Silicon Valley bros advocating for full body MRIs and full body
Yeah,
scans. And
yeah,
you
and
think that,
for every like early pancreatic cancer you'll find all sorts of other stuff that isn't, would probably never hurt the patient, but it ends up causing like expensive and potentially, risky workups.
yep, expensive and invasive. I mean, you're putting
No,
patients
that's what I said.
through, you know,
Biopsies, invasive,
biopsies and everything. It's just people don't really understand until they're going through it. They're like, wait, I have to do this, I do that. Like, yeah, this is something that we have to look into more now that we found it. But so Casey means her mother gets diagnosed with pancreatic cancer, and for her it becomes a bit of awakening that, well, I should have done more. The medicine
or
world
I
should have
should
done
have
more.
seen the signs. She thought that there should have been like biomarkers that could have picked it up earlier, and like she felt guilty that she didn't pick it up. But she should know that there's no reliable biomarker for pancreatic cancer right now. I wish there were, but there isn't.
Yeah, that's one of those diseases that unfortunately we can't screen for effectively despite its deadliness.
It's like she pretends like no one's ever thought of this, or like so many of ththese doctors when there's like reams and reams and reams of research and arguments pro and con about various screening modalities that have been tried and, that sort of thing.
And look, my heart goes out to her too because I can see if my family
Yeah.
member got diagnosed with cancer. So my father was diagnosed with kidney cancer, and the only way it was caught was he was diagnosed with prostate cancer. So
Yeah,
what
well,
do they?
which as we like to say, I mean, more men die with prostate cancer than of it.
Right. But, they did like a screening CAT scan of him, and
Right.
all of a sudden they found the tumor going from his left kidney all the way up his vena cava to behind his liver. It just followed it up.
Okay, that's
How long has it been growing for? Who the heck knows? Now, again, he had no symptoms. There was no blood in his urine or anything like that. He managed to get a full nephrectomy. They removed the tumor. There was no liver invasion. And then, this was 13 years ago, and knock on wood, thank God he's
very
alive today. But, that's one of those things where that type of cancer killed my grandfather in a way. So, these are silent cancers that exist and they're difficult to treat and difficult to detect unless something happens earlier. So my heart in that situation goes out to her, but now I feel like she used as an excuse, but rather than use it as an excuse, why don't we now say, I'm going to be a better clinician for it. I'm going to do a more thorough job. I'm going to use the evidence available to me and possibly make improvements to things like that. I'm going to advocate for something like this. But she kind of went in the opposite direction. Like she kind of said, well, medicine is this and we need a different approach entirely. So here's 100 labs that will see if something's wrong with you. Like,
Mhm.
okay, sure.
Again, it's like it comes across like a conversion story and that she had this revelation, which
Hmm.
we hear this a lot among doctors who kinda go down this path. It comes across as more, faith-based than evidence-based.
Right. Right. And the faith, though, has a very large and rabid following, especially on social media nowadays. I don't know, have you gotten like death threats and threats and all that stuff on social media over these things?
It's kinda weird. Actually, lately, not as much. Back in the day, I mean, we've been sued at science-based medicine for, article we wrote, one of our members wrote about a chronic Lyme disease doctor. I've had
Hmm.
a number of legal threats. I've had one cancer quack who's, like, harassed me at work by emailing, like, my chairman and, like, basically pretty much every faculty member in the department. It's
Nice.
like
That's always nice for.
but this was before the pandemic. Oddly enough, since the pandemic, it has, I've had anti-vaxxers threaten to, like, demonstrate outside the hospital, outside the cancer center, just to show this is nothing new. So I first started writing my blog in December of 2004, and back then I was doing it under a pseudonym.
Hmm.
And it was less than 6 months before I was doxxed, and there was this cancer quack emailing my chairman and my cancer
Wow.
center director and my division chief, with threats. And this was
Wow.
2005. So this was
Yeah.
2005,
This is like, early internet days that you were doxxed out and found
The
out,
early blogging days more
But
like the
yeah,
early internet days would be more the 90s,
that's
but,
true. It's funny how persistent a lot of this group can be. And, I mean, look at Peter Hotez. He had
No,
people
he gets it way
just
more than I do because his profile is so much. I mean, I've never been on Fox News. I've never
fair.
been on
Yeah.
like national news broadcasts being interviewed. It
Hmm.
just, I'm not that high profile. I like to call myself like a micro or a nano celebrity.
Yeah.
It's like,
Yeah.
I mean, I'm known, but not like that.
Now, here's a bit of a devil's advocate question for you.
Mhm.
Is functional medicine doing something right? Is there something into functional medicine is doing that, medicine, Western medicine should maybe take a lesson from?
It's one of those things again. I suppose it depends on whether you accept what they say is patient centered care, right? You could say that any alternative medicine does right compared to medicine is spending more time with the patient, trying to listen to the patient, and that sort of thing. I suppose you could argue that maybe spending more time on nutrition is valuable, but that would assume that you're using an evidence based approach to nutrition, which,
Right.
they are
Absolutely.
not.
Like I said, one of my colleagues kind of went down the functional medicine rabbit hole, and to listen to their concerns, their concerns are valid. Their idea that, listen, something has been going on. I don't feel like my concerns are validated. I feel validated using this model. And yet I say to them, well, what are they telling you to do? Well, they're telling me to eat healthy and to exercise, but that's what we're telling you as well. Like nobody's telling you different. It's just that they're also selling you supplements and these extra things on the side with no proven benefit. And you're spending how much money a month on this? Like let's take a step back here and say, what do I really need? What am I getting out of this? If you just want validation, talk to somebody that you feel comfortable that does validate your concerns. That's not a quack. That's
Right.
point one and the final point of the whole thing here.
And I mean, the other thing that they do, is they'll take some evidence-based medicine, but then they will, like you say, add the supplements,
Hmm.
add the naturopathy, add the acupuncture, add all of that. In some
Manipulation. Let's
instances, even
crack some bones
homeopathy,
here. And I say that as a DO where I got trained in manipulation. And yeah, I don't know about some of that stuff, but I don't crack necks for various
No, no,
reasons.
no. I mean, obviously, for some forms of back pain, the manipulation could be potentially beneficial. I never deny that. It's just that chiropractors go way beyond that. I mean, way beyond that.
Well, as an emergency physician, I've seen a couple of vertebral artery dissections
Sure,
from the
but
necks.
a lot of them claim that you know manipulation can cure everything, not just back pain. And it's when it's arguable that whether it does a lot for back pain or not.
Yeah, I mean, there is obviously that kind of
It's a spectrum. I
scale
mean, yeah. I
of,
mean,
there's a scale of, even modern medicine, physicians with what, yeah, we're not going to get into that right now. But, I think the concern that I have, and I think that we as an organized medicine has with Casey Means being the nominee is obviously one, putting an individual pushing unproven, untested, really BS therapies into a position of such power is dangerous.
No, definitely. I mean, now on the one hand, I mean, the Surgeon General doesn't actually have any real power except over the Public Health Service. But the Surgeon General has traditionally been, like quote unquote America's doctor.
Correct. Yeah. And how can you say that they're America's doctor when they haven't even gone through residency and treated patients clinically? I, I I'm sorry, but that's kind of my take on this. You should have somebody in that role who has treated patients clinically with evidence-based medicine, and this isn't
And
it.
not as a trainee, because
And now as a
obviously
trainee,
she
you're right.
did as a trainee.
Correct. I credit a lot to Jerome Adams, Trump's 2016 Surgeon General, a DO, and his approach was valid, and he has spoken out even to this day about a lot of things going on in the U.S. healthcare system. And how do you speak out about things at a public health standpoint to the U.S. healthcare system if you really haven't practiced clinically in the U.S. healthcare system?
That's the other thing about a lot of functional medicine. They find ways to bill insurance for some things because, like
I'm
routine
surprised
lab, like
insurance pays it.
if you send like a chemistry panel, you can get insurance to pay for it, that sort of thing, and thyroid function tests and stuff like that. But a lot of it is, cash on the barrelhead.
Right. Right.
Like Hyman, for instance, offers like this whole like subscription plan where you get every 6 months you get 150 or 140 lab tests, and
Boy.
you can talk to one of his functional medicine docs and that sort of thing, and the health coaching and all that. It's all like a package.
Hmm. And that sounds pretty damn good, man. It's like, oh, I get to know everything that's going on in my body, my biomarkers. Like, it sounds so good and so scientific, but at the end of the day, it's worthless. It's worthless information. Well, Dr. David Gorski, thank you again for coming on, talking about illuminating us in functional medicine on the background of Casey Means. But if you're somebody who is interested in exploring functional medicine as an alternative, be mindful. They sell you a bill of goods that's unproven, that can show you a lot of nonsense and make you feel worried for nothing, all while draining your bank account.
Yeah, I'll just say, one way I characterize functional medicine, as I was looking at, I called it reams of useless tests in one hand, a huge invoice in the other. Like
Hmm.
I was riffing off that Mitchell and Webb video, sketch on homeopathic ER.
So buyer beware. Buyer beware. Please talk to your
Unfortunately,
doctor.
it shouldn't have to be that way. We should have better like regulation and oversight, but that's the way it's going.
Well, that's the topic for another episode, man. Regulation, everything else.
Yeah, don't get me started.
Well, Dr. Gorski, thanks so much for
Right.
coming on.
Oh, thanks for inviting me.
We'll have you on some other time. We'll talk some more depressing stuff
Well,
for
there are
sure.
so many topics, unfortunately.
All right. Take
All right,
care.
thanks.
And that wraps it up for us here at the JAFERD Cast with another episode. My thanks again to Dr. David Gorski for coming on to talk to us about functional medicine, and in general, be aware of grifters, scammers, and people who are looking out for not your health, but rather your wallet. Now, I know that doctors are not perfect. Physicians in general can be quick, rude, abrasive, and that's just me on shift sometimes. But we really do try our best. We as a collective are looking out for your own well-being and your own health. If we give recommendations, they're not made lightly. It's backed by decades of peer-reviewed evidence. There are people who call that into question, people who want to take your money regardless of your health outcomes. And that's not right, and there should be oversight on that, but unfortunately there isn't. So buyer beware, and please, like anything else, please speak to your own doctor when making decisions about your own health or the health of your loved ones. If you want to see more science-based research or evidence and opinions from Dr. David Gorski and others in his field, please go to sciencebasedmedicine.org. There you'll find numerous entries and topics regarding everyday science, everyday medicine, things that are coming up in the news cycle faster than I can produce an episode. So thanks again, Dr. David Gorski, for coming in. Like always, take care of yourself and make good choices. I'll see you next time.